World Health Organization has warned that the new coronavirus variant, Omicron, is spreading across the globe at an unprecedented rate, with cases of the heavily mutated variant confirmed in 77 countries. Speaking at a press conference, the WHO chief, Tedros Adhanom Ghebreyesus, said the new variant is probably in many others, but yet to be detected. He says he is concerned that not enough was being done to tackle the variant. The WHO's latest data suggests the variant, first detected in South Africa in November, can better evade existing vaccines and carried a higher risk of reinfection, leading the organization to say the level of risk remains very high. In Tuesday's news conference, the WHO boss reiterated concerns about vaccine inequity as some countries accelerate rollouts of a booster shot in response to Omicron. It said boosters could play an important role in curbing the spread of Covid-19, but that it was a question of prioritization.
Reported cases of Omicron, and the reality is that Omicron is probably in most countries, even if it hasn't been detected yet. Omicron is spreading at a rate we have not seen with any previous variant.
Let's broaden this out by speaking with medical doctor Femi Oyekan, who is joining me from the Southern University Hospital from the UK for more on this on Omicron variant. Thank you so much for joining us on World Now. A number of countries have introduced travel bans affecting South Africa and its neighbors following the emergence of Omicron, but this has failed to stop it from the spreading around, from around the world. Does it look like not enough was being done to tackle the variant? Do you think that we have underestimated COVID-19?
I'll say first, absolutely, enough has not been done. I think the blame can be shared across boards. One is the richer countries ordered the vaccines and think that by protecting themselves, they will be protected. Now, the variant that has developed, the Omicron variant, which is now very highly mutated and can bypass vaccines and protection and get people seriously infected, was detected in at least, it started with, we'll say credibly, from poorer nations who, one, were not wealthy enough to get as much vaccines as possible, and two, lack of response, because there were some situations where we have in Botswana, in South Sudan, where people had the vaccines but did not go to take them, and at the end, the vaccines got expired and were chucked away. So it's a blame that is not going to be on one side. Worldwide, COVID has not been taken as serious as it should be, but the blame should be spread across board. But I think not so much of looking at who to blame now. The question should be, how can the world respond credibly moving forward? So, and the response should be a credible sensitization from all government and social organizations to ensure that we get as many people across the globe vaccinated as soon as possible, so that another variant doesn't develop that will become even more dangerous than the Omicron variant.
Right.
So,
right, Dr. Femi, the WHO's latest data suggests that the Omicron variant can better evade existing vaccines and carries a higher risk of reinfection, leading the organization to say the level of risk remains very high. So some significant number of people are still skeptical about the vaccines because the question, why should you still be infected after vaccination?
I think that the variant that the alpha and beta variant that initially spread from China were the basis for development of the vaccine. So at the end, it turns out that the vaccines were effective against those earlier variants. But the Omicron variant is like I said earlier, is a very highly mutated, multi-spiked variant that has more mutation than what was initially the vaccine was developed for. This is why it has the capacity to escape the immune system and cause infection. Now, the game changer will be as many people that are capable of being vaccinated should do it as soon as possible, so that we are able to stop COVID once and for all. Because if a mutation develops and people have already had enough immunity, it's unlikely that that mutated virus is going to spread. So in that way, you possibly would have now developed herd immunity to be able to stop COVID globally.
Right. So then, in poorer countries, for instance, some vulnerable people are yet to receive a single dose. WHO said boosters could play an important role in curbing the spread of COVID-19, but giving boosters to groups at low risk of severe disease or death simply endangers the lives of those at high risk who are still waiting for their primary doses because of supply constraints. So what should be the priority here?
I think the priority is go get vaccinated. That should be the priority. And what initially the African nations were thinking of doing to ensure that vaccine production sites were created in Africa, so that some of these vaccines, because of the cold chain that they need to be maintained, it's difficult for you to ship them from US, from Holland to Africa. And sometimes because the expiration date is usually very short, sometimes like in the case of Botswana, it was already almost close to expiration before they received it. So eventually they were unable to do a lot with it. So I think the situation should be creation of vaccine centers, vaccine production centers in Africa, so that Africa can get themselves vaccinated by themselves. If you're thinking of the option of persistently waiting for vaccines to be delivered from abroad, it's not going to solve the situation on ground. Africa has over 1.5 billion people, and you need at least 1.2 billion to be vaccinated. And if you're talking about people receiving booster dose, that means at least you need 3 doses. That's about 3.6 billion doses for 70% of Africa to be vaccinated to a point that we can develop herd immunity.
Right, Dr. Oyekan, let me just butt in and by re-emphasizing what the South African doctor said, that that we are just panicking unnecessarily with the way the countries are going about it. For instance, the UK government announced that all 11 countries on its travel red list will be taken off, with its health secretary saying the Omicron variant had spread so widely that rules no longer had much purpose. So, but people will always travel. What should be our hopes for the nearest future?
I think going by what has been happening, I would still suggest before you travel abroad, ensure that you do your COVID test. If it's negative, that's good. And like what they do here in the UK, before the red list was introduced, now it's been discarded, like you rightly said. People need to take COVID test day 2 post arrival to be sure that some of these infections are not things you can see physically. So we still depend on a lot of tests to be able to detect who has the disease or not. But fundamentally, what will help will be face mask, hand washing, social distancing. Those basic hygiene rules are what I would say both people traveling and those staying at home should strictly adhere to. This in a way will help keep a lot of our people, both vaccinated and unvaccinated, safe.
So by trying to find out what should be our hope for nearest future, I'm trying to to ask you whether we should just assume that COVID-19 is not going to go anywhere, that it's just going to remain with us, just like HIV and AIDS, malaria, etc., etc. Is that the reality as a doctor and a researcher?
I'll say that in a way, it's going to be here for a long time, and very, very long time. But I don't think it has the capacity of HIV. That HIV will not be able to develop an effective vaccine for HIV. We are now going to be depending on drugs. COVID is going to be around for a very long, long time. But what we are trying to do as health experts is to ensure that it doesn't have the potency and it doesn't keep making headlines like what is happening now. That a variant pops up and the entire world is panicking. We want a situation where we have effective vaccines that can put COVID under check, so that even if we have sporadic COVID outbreak in some spots across the world, you know that we have already arsenals to combat it effectively. But that is going to go anytime soon. I strongly doubt it. The facts on ground does not support that. It's going to be around for a very long time.
If you look at the western part of this world, talk about the United States, they've recorded more than 500,000, infections, deaths, rampant in other countries compared to African nation, Nigeria, for instance. We've hardly recorded 3,000 deaths. Is there something that we are doing in Africa that some of these countries are not doing? Or is it just a matter of grace?
I'll say the disparity is multifactorial. The more you test, the more you are able to detect who has and who doesn't have it. And it's been shown by data available from credible authority that the weather in Africa has not really has been really positive in terms of not allowing the spread of COVID to be as widespread as what we have in Western world, where the weather, sometimes the temperature is -5, -10, and all of that, which in a way supports not just COVID, but a lot of the flu illnesses. So, I'll say that on one hand, the weather in Africa from global data has been very helpful in order to limit how much spread, but it will not take it away from the fact that there is poor data documentation as regards to number of cases in Africa, and Africa has not been testing enough. We had to buy some of these testing kits to be able to, and the suppliers will have to supply them for you to be able to test.
Right.
So Africans are not testing enough to be able to have the required numbers, because I know by experience that our approach to health has not been it's not as enhanced as that of the Western world, where every I needs to be dotted and every T is crossed.
Right.
I would say sufficiently Africa data are not very, are not reliable.
So let's just keep hopes alive and see how the entire COVID-19 brouhaha will actually, end, because that's what we really want to see in the nearest future. Medical Doctor Femi Oyekan, who is joining us from Basel University Hospital, UK. Thank you so much for your insight.
Yeah, you're welcome.